Welcome from the break. If you are just joining us, you find us at the Tech Note leg of Morning at NTV this Friday, and we are going to be speaking and covering modalities of cochlear implant. I have two experts in the studio that are going to help us understand the dynamics, but also give us perspectives on what should shape the decisions we make when especially it comes to hearing impairment. But let me first give you a preamble on exactly what this is all about. The first ever Cochlear Implant Day was celebrated back in 2009 by a group of Spanish cochlear implant recipients called Federación AICE. I hope the Spaniards won't come at me for that. It was soon adopted by cochlear implant institutions in other countries. Today it's celebrated by recipients and organizations worldwide. The 25th day of February because it's the anniversary of the first ever cochlear implantation that was carried out by French doctors Charles Ayres and André Junot in 1957. Their device used an electrode with a single channel to stimulate the auditory nerve and allow some perception of sound. It's estimated that over 700,000 people around the world have a cochlear implant. But how much do we know about this? In studio, I have two experts who are going to help us. Eddie Mukaaya is the executive director. Hear his voice, and Dr. Christopher Ndorelire is the head of ENT at Makerere University Hospital. Gentlemen, welcome to the program. I want to begin with Dr. Christopher Ndorelire. Cochlear implant. It's the very first time I'm interfacing with this term. What is it, and what is the device all about?
Thank you. Cochlear implants are electronic devices, and these devices help us or help people with sensory deficits, which is hearing loss, and mainly the sensory deficit should be from probably the people who have moderate to severe hearing loss. But particularly for cochlear implant, people who actually benefit from them are people with severe to profound sensorineural hearing loss. Such individuals may have tried to use hearing aids, which I think you've heard about.
Yeah, sure.
People use them.
That's right.
But they may not have benefit from those hearing aids. So it is a device that helps you if you developed a very severe or profound hearing loss, so that you are able to continue to perceive speech, or continue to perceive or listen to music, and also importantly to understand the environmental sounds that are within us. You know, it's very important for somebody to know that there is a train coming, that a fan is moving. You know, that is how our bodies are protected, so that we don't get injured and hurt.
That is right. Now, a cochlear implant is different from the usual hearing aid. Yes. First, enlighten us on that, so that somebody understands exactly what the hearing aid is. And then my quick assumption, the implant is internal. The hearing aid is more like external. But that is very surface area knowledge.
Yeah, but you have knowledge. At least you know that somebody with a hearing loss can be aided. First, hearing aids help amplify sound. Their job is acoustically amplify sound.
That's right.
So when they receive sound, through their mechanisms, they amplify it and then send it to the ear, which will eventually send it to the brain.
That is right.
And then we are able to hear if we have a hearing loss. So basically, in simple terms, hearing aids are means of amplification of acoustic sound. Now, cochlear implants do something different. in our ear, the ear is divided in 3 parts. So the first part, which you already see, which is this, the ear, you see this, that's the external. Then there is the part which is in the middle, and then there is the part which is, we call the inner ear. Now the inner ear has nerves that carry impulses, electrical impulses, to the brain area, which
for
helps
processing.
us hear. We don't hear with our ears, by the way, we hear with our brain. If you have
wow.
So,
I'm learning.
When we the issue of the cochlear implant, that the inner part of the ear that is supposed to convert the mechanical sounds that you're hearing into electrical impulses has a damage. You know, so when it has a damage, the outside ear and the middle ear will collect the sound, and as it's supposed to be transformed into electrical impulses, that because the brain understands electricity, that is supposed to carry those impulses, electrical impulses to the brain, is damaged. So the sounds can't come through the middle and outer ear, they end there. Now, because the cochlear implant helps solve that problem, it is the inner gadget which is electrical also, so we implant an electrical gadget in your ear, the inner part of the ear, which is the cochlea, as I know many of us have done primary science. We put in an electrical gadget there, which now converts the sound that has come in from the outer and inner into an electrical impulse, and then passes it to the nerve. Then the nerve will take it to the brain. Have you got the difference between the two?
I have gotten the difference, but I needed it to be in the layman's language so that somebody can quickly figure it out. And I don't know, but we shall come to that very shortly. Allow me bring in Mr. Eddie Mukaaya. You Hear His Voice is an organization, right?
Yes, please.
Yeah. Tell us about your work and the incidence of this condition and the need to intervene the way you do.
Okay, thank you, and good morning, viewers. Hear His Voice Uganda, we work hand in hand with the doctors to help the actualization or the realization of the treatment. Like Dr. Chris has said, hearing problem requires a multifaceted approach to get the results. So you need speech and language pathologists, you need audiologists, you need ENT surgeons, you need social workers, and the families to be in tandem with what is happening, so that we all are in the same place to receive the intended results. So what do we do? That was your question. We offer specialized rehabilitation to recipients of these implants that Dr. Chris has been talking about. Recipients of hearing technology and recipients of hearing aids and cochlear implants. So when the surgeons have put the implant in, the audiologist needs to switch the implant on. And after it's been switched on, the speech and language pathologist needs to take through the patient to learn. He said, we hear using the brain. So just assume that the ear is the doorway to the brain. So the brain has been denied of hearing for quite a while. But when the implant is put in, or the hearing aid is being put on, there is access to these sounds. But the brain is not used to this, doesn't know what is going on.
So fundamentally, when I come back to the aspect that we left off with Dr. Christopher Ndorelire, it's a case of conversion and amplification. The aids amplify. In other words, the door is there, but the sound is low for the sake of the aids. And for the implant, there isn't access completely
to the brain.
to the brain. Wow. Statistics here indicate that as of December 2019, approximately 736,000 registered devices had been implanted across the globe. In Uganda, what are the statistics? Is that a question for the doctor, or
we could answer it?
Oh, please do. You're working directly with
Yes, this is a new science in our country. I think we had the first cochlear implant implanted in Uganda in 2007. That was a student at Makerere University who suffered from TB and got anti-TB medication. He got healed, but he developed a hearing loss. And he was, I think, in second year. I don't remember the course, but one of the arts courses. Agriculture? Yeah. So he received the first implant. That was the first one done in Uganda about 2007. And I know several other people have been doing it outside the country, but coming up and attending rehab maybe at Edis or any other places. Now the science has been developing and evolving within the country. I would like to think that currently we have about 60, between 60 to 80 cochlear implant users. I am not specific with the numbers because some people might fly to get the implants outside the country. Yeah. But I wouldn't.
And most of the time, experts are dealing with estimates that
so
are sufficient sample spaces.
70 to 80 cochlear implant users in the country.
Okay. And with regard to the nature of work that you're doing with the organization, Hear His Voice, I'm inclined to think this is a very costly device. Are you rolling it out at subsidized rates, or how is it happening for those that need it?
Yeah, actually that would be Dr. Chris's question, but that's okay. We are talking about technology.
Yeah,
and you're talking about medicine. So you're also talking about specialized approach to treatment, which requires specialized skills.
That's right.
So it is inevitably an expensive venture. But when you look at the cost of having an individual with hearing loss the rest of their life, vis-a-vis the cost of a cochlear implant. Having a cochlear implant is much cheaper.
It's cheaper
than the other cost.
Living
and again, that is the awareness for the cochlear implant there, so that people can come to the knowledge that there is solution out there. Much as it looks expensive, down the road, it's actually a cheaper investment. You invest now in a child who would, the rest of his life, depend on other people to live his or her life. So, but if you invest it now, this child will become independent, this child will go to school, this child will get a job, this child will pay taxes. So even the government will benefit from this individual, as opposed to spending on this individual who is left behind.
I see you there. You're directly speaking to parents or guardians who have children that are deaf.
When you say deaf is a different word.
That's a different word.
We take it from deaf. I'm not going to go into the science. So
okay. All right. Since I'm approaching it from the
other side.
The other side, yeah.
Yes.
So help me.
From severe.
Severe.
To profound. Yeah. And then you go to deafness, which is the last word to use.
Okay.
In terms of
in other words, I'm being too harsh.
You're being too harsh.
Okay.
Yes, because even if you have just severe, you may perceive with very good amplification, but you may not be able to have comprehend, and although your receptive and expressive speech may be useless to you. So all that spectrum of children running from severe and cannot be aided by the hearing aid can benefit. That's severe, profound, and this can run from adults and children. Kindly remember that hearing loss is something which is that anybody can get at any time.
Right.
Perfect. And that brings me to the question, what are the most notable causes of hearing loss to an average Ugandan?
I'll take it from two sides. I'll start with the adults.
Yep.
You've been hearing and you're working like you are, and then you're hit with an illness, and then you're given a drug. There are drugs that can give you hearing loss in totality. So there are drug-induced hearing loss. Then there is noise, you know. You are close to maybe heavy blasts, you know, those quarry areas.
You're a DJ.
You're a DJ. You are working in places where there are industries. There are so many coming up, which is good, but people don't want to observe the public health protocols of checking ears and in every year, so that should happen. Then people develop hearing loss because of noise. Then there is trauma. You know, there are so many borders in our country, and they get injuries on their heads, especially this area where the ear sits, and then they have hearing loss because of trauma and because of the temporal bones have been injured, so you get hearing loss. An average Ugandan can have like that. Now for children it is different. It may be genetical when it is passed on from parents to, or you had it along the line, which we call congenital, or it may be an event that happened during child labor, and the child scores poorly when they're a child, they go to nursery, they have yellow eyes, you know, such things, and then they can have a hearing loss later. They went to ICU when they were born, they can have hearing loss. So anything that is disturbing ladies giving birth, you know, delayed, you know, all those things that can cause an abnormal delivery can cause some hearing loss.
Okay.
And finally, you can have kids who have hearing loss because they develop some fluids in their ear, but those can be collected surgically. Okay.
All right. Two questions in a row for Eddie Mukaaya. Experts who are doing this in the country, how many are they, how accessible? Of course, I know doctor is one of them, but as an organization, you should be working with an array of experts on this. And then the other question is, tomorrow, the 25th, is International Cochlear Implant Day. Just take us through what the activism shall be, where the commemorations will be, and what we need to pay attention to.
Okay, okay. Thank you. Again, I earlier on talked about a multifaceted approach.
Yeah.
So we actually need experts. Even ENT surgeons, they need to go to a certain level of he's talking about the temporal bone and a certain level of skills to be able to deal with, he talked about the inner ear. So Uganda still has a few ENT surgeons. And
how many do we have?
How many do we have in Uganda?
60.
About 60. ENT surgeons, and not all of them are actually doing ears, because ENT is also a long spectrum.
Nose and throat.
Yeah, so you're talking about
most
60.
are concentrating on nose, so, and perhaps throat, where it's more lucrative to work.
Then the other specialty which is critical is the specialty of audiology, and for audiology we actually have few audiologists. You can name them on your fingers. Wow. Then speech and language pathologists, which are critical. These are the ones that need to be with the patient. I'm calling him a patient because he's being treated.
Yeah.
to bring them to speed so that they can articulate the speech sound, they can articulate the receptive and perceptive sounds and all this on a daily
basis.
and they are still few. Makerere University has a course running for speech and language pathologists, speech and language therapists.
Yeah.
And it's been around for a few years.
It is coming to 10, 12 years.
It's 10 years, okay. But like less than 10 graduate in a year.
And how many taken on?
Taken on?
As in enroll? Because that would give us perspective.
I will bounce back that question to the head of department.
It could be enrolling 100
Yes.
and only graduating 10.
Yeah,
it could be a problem of...
bounce that back to the head of department.
Okay, quickly, we have no time. Just take us through the International Day for Cochlear Implant.
Yeah, so once again, the International Cochlear Implant Day is here with us. 2009 is when the world first received it. And we are doing it for the second time in Uganda. And again, to bring this word out, that there is remedy through technology that you can get to treat hearing loss. And we are going to have a function at Wonder World Kansanga tomorrow. And it's going to run from 9 to 1. But we have set aside the whole week, next week from 27th to 3rd for an awareness week, and we're going to be doing testing of hearing loss at Makerere University Hospital in the audiology room. Okay,
thank you very much. Eddie Mukaaya, Executive Director here, His Voice Organization, and as well Dr. Christopher Ndorelire, the Head of ENT at Makerere University Hospital. Gentlemen, many thanks for the enlightenment with regard to hearing and, most importantly, the new technologies that are being rolled out. I hope whoever is there, a guardian and a parent, and you have a child, or even yourself, could be grappling with some of these issues. Do take time and go to Wonder World tomorrow as the experts and other stakeholders commemorate International Day for Cochlear Implant. That's it. I'll be right back. Stay with us.